In California, the government provides free condoms to prisoners. It might sound surprising, right? This initiative was once a highly debated and controversial topic when the local governor first proposed the plan. Critics argued that it could encourage prisoners to engage in sexual activity, providing them with more opportunities to do so. However, others defended the move, calling it a strategic decision. So, what's the real rationale behind this policy? And why is it considered a strategic move? The controversy behind condoms in prisons. When the idea of distributing condoms in prisons was first floated, it ignited a fierce public debate. Detractors raised concerns that it might tacitly endorse sexual activity among inmates, which many viewed as inappropriate or morally objectionable. Some feared the potential for condoms to be misused for illicit purposes, such as smuggling contraband. At its core, much of the opposition stemmed from a reluctance to acknowledge the realities of prison life. Critics seem to operate under the assumption that sexual activity could be entirely eliminated through strict surveillance and enforcement. However, as proponents of the program pointed out, this assumption was far removed from reality. Sexual activity in prisons, whether consensual or non-consensual, is a documented phenomenon. Ignoring it does nothing to prevent the spread of sexually transmitted infections, STIs, like HIV. Condoms, therefore, were not introduced to condone or encourage such behavior, but to mitigate its public health consequences. Why condoms? To understand why California chose this path, it's essential to examine the two driving forces behind the decision: public health concerns and cost-effectiveness. A public health imperative. Prisons are environments where health risks can escalate rapidly. Close quarters, high stress levels, and limited access to medical resources create conditions where diseases spread easily. Sexually transmitted infections, including HIV, pose a significant threat in these settings. The absence of protective measures like condoms exacerbates the risk. Consensual relationships between inmates are not uncommon, and tragically, instances of sexual assault also occur. In both cases, the lack of protection increases the likelihood of disease transmission. The financial logic of prevention. The financial burden of treating HIV is staggering. According to the National Institutes of Health and NIH, the average lifetime cost of treating an individual with HIV is approximately $420,285. This figure, based on 2019 data, only accounts for medical expenses and does not include the social and economic ripple effects of the disease. By contrast, high-quality condoms cost about $1 to produce. This stark difference in cost highlights the economic wisdom of California's decision. By preventing the spread of HIV and other STIs in prisons, the state reduces the long-term financial burden on its healthcare system and taxpayers. The implementation of AB 966. The pivotal moment came in 2014, when California passed AB 966, also known as the Prisoner Protections for Family and Community Health Act. This legislation required all state prisons to provide condoms to inmates, marking a significant shift in public health policy. The rollout began in 2015 and was implemented over the course of a year, with 3 to 4 prisons added to the program each month. Dispensers were installed in accessible locations, including gyms, housing units, clinic waiting rooms, educational facilities, hallways, and even next to telephones. These efforts ensured that inmates had consistent access to condoms, while maintaining discretion and dignity. The results of the program were both encouraging and illuminating. Over 243,000 condoms were distributed in the first year, with an average of 354 condoms dispensed per 1,000 inmates each month. Fears of widespread misuse were largely unfounded, with only 4 disciplinary actions reported for misuse. No significant incidents involving condoms were documented, dispelling concerns that the program would create new security challenges. The success of the program demonstrated that the fears of critics were overblown, and that pragmatic, evidence-based policies could achieve tangible results. Lessons from San Francisco County Jail. California's decision was not without precedent. In fact, San Francisco County Jail had been providing condoms to inmates since the 1980s, long before the state program was introduced. San Francisco's approach became a model for California's broader policy. One innovative aspect of San Francisco's program was the introduction of a vending machine specifically designed to dispense condoms at no cost. Installed in a gymnasium used by 800 prisoners weekly, the machine provided individually wrapped condoms at a cost of just 22 cents each. The program demonstrated the feasibility and affordability of making condoms readily available in correctional facilities. A paradigm shift from controversy to acceptance. What began as a controversial policy in California has evolved into a case study in effective public health intervention. The success of the program demonstrates the importance of confronting uncomfortable realities with pragmatic solutions. By addressing the spread of HIV and other STIs in prisons, California has taken a proactive step to protect both its incarcerated population and the broader community. The program's financial and public health benefits underscore the value of prevention over treatment. As the world continues to grapple with the challenges of managing infectious diseases, California's condom distribution program stands as a powerful example of how bold, evidence-based policies can lead to meaningful change. It is a reminder that even in the most challenging environments, innovative solutions can pave the way for healthier, more equitable futures. Protecting public health beyond prison walls. The spread of diseases like HIV isn't confined to prison populations. Inmates who contract infections while incarcerated can transmit them to others after their release, creating broader public health challenges. By curbing disease transmission in prisons, California's program indirectly protects the wider community. Economic benefits for taxpayers. The financial logic of prevention is compelling. Treating HIV is far more expensive than preventing it. By investing in a low-cost solution like condoms, California reduces the long-term economic burden on its healthcare system. Acknowledging human realities. Incarceration doesn't erase human biology or needs. Recognizing this fact and addressing it with practical solutions is a step toward creating more humane and effective correctional systems. This approach also acknowledges the dignity of inmates, ensuring that they have access to basic health protections. California's decision to provide free condoms in prisons is a testament to pragmatic, evidence-based policymaking that prioritizes public health, economic efficiency, and human dignity. Despite initial controversy and resistance, the program has demonstrated its value in curbing the spread of sexually transmitted infections, including HIV, within correctional facilities. This proactive approach not only protects the health of incarcerated individuals, but also safeguards the broader community by addressing the ripple effects of untreated diseases. By acknowledging the realities of prison life and implementing cost-effective preventive measures, California has set a precedent for addressing public health challenges with innovative solutions. The program's success underscores the importance of confronting uncomfortable truths with compassion and practicality.